Scott, those temperatures looking pretty good. All right, listen, if you've ever had that dry feeling in your throat or trouble tasting or speaking, it could be symptoms of a common oral issue. And today, Dr. Ake with Delta Dental is explaining the causes and treatment for dry mouth. And we're glad that you're here with us today.
Thanks for having me.
Yeah, so first of all, tell us, I feel like most people would know what dry mouth is, but maybe explain that and some of the symptoms that maybe people don't know.
Yeah, dry mouth affects all of us, right? You wake up in the morning, sometimes you have it on a hot summer day, when you're exercising, working in the yard, or even when you're nervous, that sort of thing. When we talk about it as dentists with dry mouth, we're talking about the chronic, persistent bad taste in your mouth, the dry mouth that's going on, and the lack of saliva flow that's going on behind that. It can be unpleasant and potentially harmful.
So what are some causes of dry mouth?
Well, there's several things that contribute to it, right? The biggest ones we see are hormones, illnesses, medical conditions. If you're on medication, especially a lot of them, that can be a big contributor. And of course, the ones you guys have probably heard before, alcohol, caffeine, and nicotine contribute as well.
We're seeing some information on the screen right now. So if people are experiencing dry mouth, what can they do about it? Tell us you brought some things here that I think are probably helpful.
The biggest thing I would say, there's a lot of factors that go in. If you feel like your medications are playing a part, schedule time to talk with your primary care physician. If you feel like they are contributing, maybe you can find a way to adjust your medications, obviously after talking with your primary care physician. And if there's two actions I can suggest to your viewers that are suffering from this, it would be to first try and replace some of those sugary, caffeinated drinks that they have with water. If you introduce more water to it, you're gonna help a little bit. The other thing is familiarize yourself with the dental aisle of your local supermarket. There's several lozenges, mouth rinses, toothpaste, all sorts of things that are there to help alleviate this symptom and get you back to feeling like normal.
Literally dry mouth spray. So, you know, it's right there. So there are things that can help. Is there something that we need to know? I mean, can this cause problems if we don't fix it?
Dry mouth is something that a lot of people are unaware is going on. The biggest symptoms they notice right away is that they have a gritty, bad taste in their mouth and bad breath that's linked with it. That lack of saliva flow in their mouth means that they're not washing away those food particles and bacteria that exist in their mouth too. And as you can imagine, that leads to a higher incidence of cavities and gum disease. Overall, that's going to have an effect on your quality of life.
Right, and I'm sure a lot of people think, well, I'll just chew some gum. That can cause more problems too, right? I would assume if it's sugary gum.
You're absolutely right. Yeah, so you want to check and make sure it doesn't have sugar in it. There's a good replacement called xylitol gum. It starts with an X. I'm sure it's on 6 of these items in front of me. But try and make a good habit of using xylitol gum because that can help promote saliva flow in there without damaging your teeth.
So you said you're located off Cantrell, Foxcroft area?
That's right, right across from that 7 Brew there.
Okay, and the name of your clinic again?
It's Ake Family Dentistry, like a toothache.
Yeah, and he did not change his name for his profession. That's right, it's AKE. So make sure you go to the website there, deltadentalar.com, if you want to find out more information. And Dr. Ake, thank you so much.
Oh, thank you.
Really appreciate you being here. And we've got more of The Vine coming up. Stay with us.